Hello, I'm Joe Hren. Indiana's Family and Social Services Administration is preparing for implementation of HIP 2.0, its healthcare expansion plan, even though federal approval of the program could still be months away. Only Hoosiers earning up to 100% of the federal poverty level, it's about $24,000 for a family of four, are eligible for the current Healthy Indiana plan. That leaves more than 300,000 people without affordable health insurance coverage. Now, HIP 2.0 would expand that up to 138% of the poverty level. That's about $33,000 a year. A mandatory public comment period for the proposed plan ends Saturday, and the state will submit its request for approval to the federal government by the end of June. Governor Mike Pence is applauding legislators for putting the wheels in motion for a possible constitutional convention, but he's stopping short of endorsing the idea. Pence says he'll leave it up to the delegates from 33 states who came to Indianapolis to decide whether to go through with a call to force a convention to debate constitutional amendments. He says he's grateful they've taken the initiative to explore invoking a never-before-used provision allowing 34 states to demand Congress call a convention. Pence notes he sponsored a balanced budget amendment when he was in Congress and says he'd support the states sending it to Washington or vice versa. State Senate President Pro Tem David Long has said he'd like to see an amendment limiting the scope of federal authority as a means of bringing the debt under control, but he's emphasized delegates aren't to the point of debating specific amendments. They're focused on planning the mechanics of the convention itself. And now a quick check of the weather tonight. A slight chance of thunderstorms, lows down to 68 and 90s in the 5-day forecast. For WTIU News, I'm Joe Hren.